So we've talked about the provider's perspective, and we've talked about the patient's perspective. So now let's talk about their communication. Um, the relationship that doctors and patients and providers and patients have is complicated because medicine is both a caring profession and a business. And as a result, there are some elephants in the room. These include insurance. Patients and doctors both report that the influence of insurance and managed care on the doctor patient relationship has been detrimental to it. When you have that fee for service model, patients question whether there's a procedure that's actually necessary or are doctors just doing this for the money. With HMOs, doctors are under increased pressure to see more patients and spend less time with individual patients. And as a result, their communication can become more formal. Doctors may also feel pressure to cut costs in managed care and then not refer patients to the specialists that they think are the correct ones. And patients, in turn, may distrust physicians who they feel really have more of a loyalty split between the managed care organization and the patients themselves. We have malpractice insurance in there. Further pressure is brought to bear on physicians who fear that, they could be in trouble. They could be sued. So they may do more tests than they ordinarily would, in contra indication of what their employer wants. And so, it's what's called CYA medicine, cover your ass medicine, but that's not really good for anyone. So we end up with these real different expectations where patients come in with different ideas about what's possible and what a doctor-patient relationship should be. And we also have those knowledge differentials. And, oftentimes you hear physicians talking about, a patient is non-compliant, which is a really loaded kind of term to suggest that a patient should comply. And those power differentials come in all sorts of ways with communication. So we're going to talk about the communication accommodation theory, which is a type of theory looking at patient-provider interactions. And it talks about three different styles of communication: convergence, divergence, and over-accommodation. And I'm just going to go through those. So in the convergence model, we have a style of communication that emerges where people from different groups alter their communication styles in ways that emphasize similarity. So doctors using a style of convergence will attempt to speak in layman's terms and avoid medical jargon. The doctor tries to give instructions and information in a way that is most likely for the patient to understand. In contrast, divergence is a style where people from different groups alter their communication style in ways that emphasizes difference. So doctors using this style of divergent communication will emphasize their status and medical expertise, and this creates distance. And they'll use a lot of complex jargon. I was looking for just the jerkiest image, and this was the one I found. Don't confuse your Google search with my Harvard medical degree. You may have had this doctor before, and you probably feel the rage boiling up in you as I do just looking at that. Another type of communication is over-accommodation. And this is where people alter their communication style in a way that emphasizes difference, but really for a different purpose. So doctors are stressing their knowledge and simultaneously talking down to a patient, patronizing them, making them feel like children. So I love this cartoon. I appreciate you explaining it to me in terms I can understand, especially the part about Mr. Stomach and the food choo-choo. So I think particularly when you're younger, you can feel that people speak to you in this way in the medical setting. Researchers who advocate patient-centered approach to healthcare say that an approach has three basic assumptions. These are radical. Hold on there. The first one is patient experience matters. Oh my gosh. Ready? There's another one. Patient identity is a central issue in a patient's experience of illness. So their perspective matters. And that the patient must be understood in context. So understanding that it's where the person, the patient's experience is central, how they think of themselves, and the context in which they live matters. Practically, for practitioners, this means that they need to ask more open-ended questions about patients' feelings and their needs. And providers shouldn't assume that patients always understand the message that they as providers are sending. And so it's important for practitioners to engage in a convergent style of communication. I know this doesn't seem radical, and yet researchers had to prove this to doctors that it mattered. So that shows us we've got some work to do. It's also important in terms of improving provider-patient interactions for the patients to do some things. So recognizing that, you know what, your provider has a difficult job, right? That it's a complex thing that they're doing. That your provider has time constraints, and it's not about them not caring. It's just that, you know, this is part of the job. And they need to have a patient who's knowledgeable about their own health issues and assertive in conveying those needs. So when you have better communication between patients and providers, you get better results. So as a patient, when you're going in, being aware of those things when you go into the room, that you can clearly state what's going on, that you recognize that the physician may not have endless amounts of time to speak with you, and that you're clear about what you need to the extent that you can be. Improving communication is central. And we find in research that patient-centered communication is the way to go. We have greater healthcare satisfaction, greater treatment adherence, improved psychological health outcomes, and improved physical health outcomes overall. So communication is central. It's not just about the technical skill of a provider, it is about their communication skills.